Hello, dear friends from Sudan. I'm Renzo Ginto, the Liaison Officer to the World Health Organization of the International Federation of Medical Students Associations, or IFMSA. I'm speaking to you right here from the WHO in Geneva, Switzerland. And first and foremost, congratulations to your National Assembly. I really wish I could be there in person, but as I've said, I'm here in WHO and there's so much to do here. But I'm very optimistic that we will be meeting each other in the future. I also would like to extend my congratulations once again to Salma for being our incoming Secretary General of the IFMSA. It's really a good news for all of us that we have representation from the Global South in the Executive Board of IFMSA, and we really need more people from our part of the world to be greatly involved in the work towards better global health. She asked me actually to record this short video, a short message for your assembly, and I thought that this is something that I wouldn't like to miss. That's why for the next 10 minutes I'm going to talk about global health. She asked me to talk about sustainable development and the role of medical students and young people. Global health. Global health is a very dynamic arena. We know that diseases do not respect borders anymore, that resources for health, like health workers, are very mobile. They cross countries, and health information flows very quickly across different countries and settings. Governance for health has become transnational. We need WHO and the United Nations system to coordinate in order to ensure that our international policies for health and beyond the health sector contribute to producing better health and reducing health inequalities worldwide. And the solutions to our many problems, or many health problems, are common and shared and requires multi-sectoral collaboration. So that is the setting that we have now in global health. It's a very exciting arena, and now more than ever, medical students need to get involved in this field. But in terms of the current situation, last April 5, we already started the 1,000-day countdown towards the end of the implementation period of the Millennium Development Goals, or MDGs. We know that there are 8 Millennium Development Goals, and 3 of them are directly related to health. But although some countries are almost about to achieve some of the goals, there are countries that are still lagging behind, if not regressing, especially in achieving the health-related goals like reduction of child mortality, of maternal mortality, and the decrease in HIV, AIDS, malaria, and tuberculosis rates. So that's the situation. And the new global health problems are also emerging. Non-communicable diseases have become a global pandemic: obesity, cancer, heart disease, and they're becoming the leading killers in not just in developed countries but also in developing countries across the world. Financing for global health is dwindling. Research, innovation, and service delivery, especially for neglected diseases that are still afflicting the global south, are declining, and climate change remains one, if not the biggest global health threat in our century. So this is the milieu, and this is the context in which we are now discussing the post-millennium development goal period or agenda, which is after from 2015 and beyond. And we as a global health community are talking about the place of health in the new development agenda that we are currently designing and shaping. Unfortunately, there remains to be still the MDG way of thinking. We talk about silos, but we don't talk about systems. The health system and the interaction of the health system with other systems like the agricultural system, the energy system, the economic system, and many other broader determinants of health and well-being. So this is something that we hope to see in the post-millennium development goal discussions, that will shape the new agenda for health and development. And the issue of health equity is still being sidelined. We recognize now more than ever that health inequalities are unjust and unacceptable, but we still have to see it surface in the ongoing discussions. So these are some of the issues, and these discussions may be happening at the global platform, but definitely have great implications in our own communities and countries. So my question is why we medical students should be concerned about these global phenomena that have implications on our country's future. One is global health, the global health system. We will definitely inherit its problems as well as the agenda and the thinking. And so we should contribute to the shaping now while the agenda is still in its immature stage and while consultations are still ongoing. Second, we are gifted with amazing tools. We have all these educational opportunities like exchanges and conferences. We have communication tools like social media that make us more empowered and enable us to connect with other young people from across the world. The frontiers of research are wide open to all of us. And for example, global networks such as the IFMSA provide platforms for collaboration at the international level. And finally, we young people have the creativity, innovativeness, the spirit of innovation, as I've said, imagination, idealism. And these are the values that we should harness in order to shape a better global health future for all of us. So now the final question or the final topic is how can we concretize all these ideas into action? First, we should begin talking about these issues at home. Lobbying, advocacy, education begin at home. And we need to study and understand these issues with our colleagues, with our fellow medical students, with our fellow health professional students, and with fellow students from other disciplines. As I've said, all these global health issues should be addressed in a multi-sectoral, interdisciplinary manner. Second, we need to reach out to our own communities and listen to their needs, to their real needs and real demands. And we need to participate in local processes, in advocating for better policies in our own backyard, in improving the implementation of programs and the delivery of services, especially to the marginalized, the vulnerable, and our underserved communities. We have to come up with innovative solutions, and it could be a concept or a technology or a way of doing things. And I'm very optimistic about the power of young people to innovate and to come up with new ideas that will shake the world. And finally, we should advocate, we should lobby, and this should be done at all levels, from local to national to global. So you can start in your own country in Sudan. You can participate in our global campaigns in IFMSA. This coming May, we have a delegation of the IFMSA in the World Health Assembly, and we're actually organizing a pre-World Health Assembly workshop on global health diplomacy, where we are gathering medical students and students from other health professions and disciplines to talk about the future that we want in terms of global health and to strategize how are we going to advocate these ideas in the upcoming World Health Assembly. So finally, having been a member or an active member of IFMSA for more than for the past 4 years, I feel very blessed that I have been given this opportunity to bridge my local experience as a medical student in a third world country and the global perspective that I've gained because of IFMSA and the many other international platforms that I've been involved in. So, and these ideas deepened my passion for global health and for addressing health inequalities worldwide, and for fostering intersectoral collaboration in order to improve the situation of the world's health. And so I encourage you to do the same, to act locally and to think globally, and combine these two ideas and find synergies between the local and the global so that we can address the issues that we all share, global health issues that manifest in our local communities. I hope that you will maximize the platform within your reach, IFMSA, your organization in Sudan, in order to contribute in shaping, as a post-2015 slogan says, the future that we want. And as future doctors and leaders of health and well-being, we already know the future that we want. We want health and opportunities for all in our generation in the 21st century. Again, I really feel sad that I can't be there in person, but I revel in the prospect that we will be meeting soon in the future and work together towards closing the gap in our generation and making our world more sustainable, healthier, and rights-based planet and global community. Again, congratulations, thank you for this opportunity, and see you soon.